Alright, so the bacteria I will be doing is anthrax, also known as Bacillus anthracis. It is gram-positive, is bacillus-shaped, and can produce spores. There are 4 different ways to contract the bacteria. The bacteria can be contracted through touching a contaminated organism or object. It can be inhaled through the air. It can be eaten in a food, or it can be injected. The symptoms of touching something contaminated are you'll get a group of small blisters or bumps that might itch around the area, swelling around the sore, and then a painless skin sore on the face, neck, arm, or hands. If inhaled, there are more symptoms for that. You can get a fever, chills, chest discomfort, shortness of breath, confusion, dizziness, cough, nausea, vomiting, stomach pains, headache, sweats, extreme tiredness, or body aches. The symptoms for if the bacteria is eaten are fever, chills, swelling of neck/glands, sore throat, painful swallowing, hoarseness, nausea, vomiting, bloody vomiting, diarrhea, bloody diarrhea, headache, flushing, red eyes, stomach pain, fainting, swelling of abdomen. If injected, the symptoms are fever, chills, small blisters or bumps at the injection site, painless skin sore, swelling around sore, abscess deep under muscle skin where the drug was injected. To diagnose that you've contracted anthrax, doctors will need to test the blood, skin lesion swabs, spinal fluids, or respiratory secretion. And the treatments for contracting anthrax are all types are treatable by antibiotics. Antitoxin may be required if the anthrax spores have become active. Survival rate. If you contract anthrax through touch, it has a 10 to 20% mortality rate. Other type of infections are much higher, going all the way up to 70%. It multiplies and kills quickly if untreated. The most recent outbreak I could find was in 2012 in Bangladesh. It was acquired through contact. Disease prevention. Antibiotics are recommended to prevent disease in people exposed to spores. The vaccine will also be given to people that have been exposed. Societal or cultural uses. In 2001, it was used in bioterrorism attacks against the news media offices and 2 senators. The history of anthrax. According to the CDC website, Moses used anthrax in his 5th plague in biblical times, making 1250 BC the first known use of anthrax. In 1877, Robert Koch used anthrax to create his postulates. In 1881, Pasteur created a vaccine for anthrax. In the early 1900s, the first aggressive use of anthrax came about by using it in biowarfare. In 1960, the first concerns of it being used in bioweapons came about, even though it was used earlier as a bioweapon. In 2001, it was used in an attack on the U.S., which I mentioned earlier, just months before the attack of 9/11. And as of 2010, a new strand of anthrax was found, which I was not able to find what strand that was.
How long will I slide or separate my side? I don't